Hi, I'm Dr. Jason Pozner from Boca Raton, Florida, and welcome to another episode of No Spin Live. We have two world-class experts with us. We have Kristi Hustak from Houston, Texas, and we have Mark Epstein from Long Island, New York. So you guys are finally back to work in Long Island, and how about you, Kristi? Why don't you start? Are you back to operating?
We are. We were blessed that we were, Texas is very, get back to the economy. So we opened April 22nd, and we have been rocking and rolling. We had in our private surgical center set up just the same way as our hospital. So we opened right away. So we have been slammed. We brought back all of our staff and hired new staff because we're that busy. We had record months all of May, and June looks like another record. So we are back in full force. That being said, Houston's numbers are climbing.
Same thing with Florida. Now, are you COVID testing all your preoperative patients?
We are. We're COVID testing every single one of them.
Yeah, we're using Microgen out of Texas.
Oh yeah, out of Lubbock. Yep, we use them for one of our PCR testing centers.
Yeah, that's who we've been spending because it's nice because it's a sputum test, not a nasal swab. So the patients like that better. We must have done like 60 or 70 patients through them already.
Nice, yeah, and we've had positives. Yeah, we've had 6 positives out of 300 about. So.
Oh wow, that's fantastic. Yeah. And how about you, Mark? Are you back in work?
We are back in work. We opened up May 18th, and we started surgery a couple weeks later. We are very busy. The schedule's booked out, and wondering how we're going to staff everything. We are COVID testing all our patients. There's a state regulation. We had to test them within 3 days before surgery, but now it's relaxed to 5 days, so it's working out a little better. We're doing the nasal swabs here. It's easy enough. We have a reliable lab nearby, so they pick it up the same day and we get an answer the next day.
Oh, wow, that's wonderful. Nice. Wonderful. Oh, I'm glad. So it's interesting that we're all seeing a big increase in demand because I don't think anyone is traveling. They're all stuck at home and they're like, I can recover at home and be on my Zoom calls within a day or two. So.
Yeah. And I think it's a lot of, people not going on vacations have that extra money they weren't going to spend. So I'm not seeing candidates that are like, oh, I got my stimulus check, let's get a boob job and be irresponsible. I'm seeing people that have saved for this, thought about this and said, oh my gosh, I think this is the time. I'm not traveling this summer. I can recover. I'll appropriate those funds there. So really good candidates, actually.
Because I've always said, I thought last July we would be rocking and rolling and be really busy because the economy was good. But last July, everyone with 2 pennies to their name went on vacation somewhere. There was my town, it was hot, obviously in Boca. Everyone was out of town. This year, I don't think anyone is going anywhere. Maybe the Keys or driving trips, but I don't think anyone's significantly going away. So I think the plastic surgeons are going to be really busy.
Yeah, no one's traveling near me.
Yeah, it's crazy. All right, so let's get to it. There was a story that we saw that we're going to talk about today where it was actually a question on Real Self where they asked the question of whether there's platinum has anything to do with breast implants and whether if you're breastfeeding and you've had implants, whether platinum gets in the milk. So why don't you guys kind of lead this off and kind of tell us about what you've read and what you've learned about this and your experience level. You want to go first, Kristi?
Yeah, sure, no problem. So, this is kind of a hot topic amongst women because obviously you never want to do anything that's going to impact the health of your children. It's one thing to do something to yourself, and so there's that fear and anxiety around breast implants. Like, oh my gosh, I didn't know, am I poisoning my child? I mean, you can Google, heavy metals and how to get them chelated, from a dozen places in your city, and so women naturally get very anxious about this. And the FDA, this came up in the FDA trials as well about the levels of platinum that are in there. And so they've done some follow-up studies from the 2000 studies when the FDA first looked at this, and they're not showing any difference. I mean, in fact, some of the women that they've done as study controls had more platinum in their breast milk than the ones they tested with breast implants. We know that you can get platinum from other sources in the country, metal teeth fills, for example, the amalgam, those have platinum in it. A lot of orthopedic devices, things like that. So there's lots of ways to get platinum in your body. And we don't even know the platinum that they're testing in the breast milk, whether that's inert platinum that has zero consequence anyways. So.
Sounds good. Mark, what is your 2 cents on this?
Well, platinum is not an ingredient of silicone. It's a reagent used in the curing process. And all the studies out there don't support that there's any higher level of platinum in the blood of women with implants and without. So and even if there was, I'm not sure what the significance would be, but there isn't. So I think it's perfectly safe.
Right. And I kind of look at this as you guys do. Like, look, if you have women who are tested with and without breast implants and the levels are the same, then, your hands go up in the air and like, okay, the implants are really not causing anything. And, every once in a while we get these spike in questions and people asking about these type of issues, yet there are millions of women that have had breast implants since the 1960s that have had good lives and lots of babies, and we really, after all this time, have never come up with anything significant that these breast implants cause. However, we actually did a study where we tested breast capsules and we found a bunch of bacteria. So I really think that could be the cause of some of the issues surrounding breast implant illness and other things, that some women may have some low levels of bacteria. But in terms of platinum and everything else, I agree with you guys. That doesn't seem to be significant, and I would not be scared if I was a woman breastfeeding with breast implants.
Yeah, both my daughters have breast implants, and I wouldn't let them get them if I had any health concerns about it at all.
Yeah, we've always said that. Would you let your family do this? And the answer is, my significant other, all our staff, everyone has breast implants, and I wouldn't hesitate putting it in any family member.
Absolutely.
Any last words from Kristi and then Mark?
No, I agree. I think that's a kind of a non-issue. We've studied it, and don't waste your money getting hair samples and checking the level and getting IV chelation. I mean, I think that's a little bit of overboard.
So I've had chelation in the past, and for mercury.
For your breast implants? So weird.
Yeah, for my breast implants. My breast implants have caused me to have to go chelation, but it's from sushi, especially tuna. It's nice. Like the mercury levels, and watch out for those steaky fish.
Fair enough.
Tuna, shark and swordfish, big steaky fishes.
Stand corrected.
And some of the farm-raised other fish. Stick with wild caught. Always a pleasure to see you all, and everyone have a wonderful evening.
You too. Stay safe.
For more information, go to theplasticsurgerychannel.com and see all of us on our wonderful videos.